Hi everyone, and welcome to your virtual setup class. This class is generally done in person in a big group setting, but obviously that is something that we cannot do at this point in time. So we are trying to make this as easy for you as possible and as thorough for you as possible. So here we go. The objectives of this class are first and foremost to inform you about the IVF process in general. We will also review the consent forms. The consent forms will not be signed until you are able to come into the office with your significant other and sign them. At this time, what we're recommending you do is actually make an appointment at a bank to have them notarized. The consent forms will be mailed to you prior to starting treatment, and these consent forms do need to be completed before you do start treatment. So again, we're recommending that you make an appointment at a bank where they do have somebody who can notarize them for you. I will go through them very thoroughly so you know exactly where you'll be signing and what needs to be signed and where the notary would sign. So that is the recommendation. If there is, for some reason, you cannot do that, you will have to schedule an appointment to come into the office to sign these, again, with your significant other. You'll both need to sign at the same time. We will also be reviewing your individualized treatment plan, and then we made some videos for you guys to learn how to mix and administer all of the medications that you'll be taking throughout this process. We want you to feel as comfortable and as confident throughout this whole process. Obviously, this is a stressful time, so anything we can do to kind of take that stress off of you, we hope giving you this knowledge will help out a little bit in that process. Your team. Currently, only the Rochester office is open, but all of the nurses will be working out of that office. So Jeanette is one of the nurses here. She is the nurse manager. Jennifer is a nurse in the Flint office. She will be working remotely. So if you are a Flint patient, you will probably still be talking to Jennifer quite frequently. Lisa, Kathleen, and then myself, Mary Grace, are all nurses that will be working with you throughout your treatment. Phlebotomy, so the people who will draw your blood are Trupti and Swati. Again, Jackie does draw blood in Flint. However, currently no one will be going to Flint at this time. Once we do open back up, Jackie will be drawing blood again in Flint. Your medical assistant is Mindy, and she is in the Flint office. A lot of you will still be speaking with her. And then once you get further in your treatment, you will meet the operating room team. Zara is our OR coordinator and a surgical tech, and Amanda and Melissa are our OR nurses. So first, I would like to take you through the IVF process in general and explain to you what it all entails. So generally speaking, when a female ovulates, she only produces one egg per month, okay? And this is if you are ovulating appropriately. We know that sometimes 2 eggs are produced, but most commonly 1 egg is produced from 1 ovary every month, and they rotate. Through controlled ovarian stimulation, COS, you will be injecting yourself with medications. Your dose is individualized to stimulate your ovaries, and this will hopefully cause your ovaries to produce multiple eggs in one cycle. Depending on what protocol you specifically are doing, you may also be taking an oral medication along with your injections to stimulate your ovaries. Again, you will get a very specified treatment plan. You will get very specific instructions on when to take which medications. Injecting yourself with these medications will allow more eggs to be retrieved and hopefully in turn more embryos to be created. Controlled ovarian stimulation also includes a medication to prevent the release of an egg before retrieval. So all of the medications you take throughout this process are very important. However, this one is extremely important. There are a couple that are extremely important, and this is one of them. If you are, for some reason, to miss this medication or to mess this medication up in some way, you do risk the chance of ovulating. If you do ovulate, there's no way that we could do a retrieval because the eggs have already been released from the follicles, and so therefore we cannot go in and retrieve the eggs from the follicles. So if this does happen, obviously the IVF process is no longer possible, so it's very important. You will get a video later in this presentation about these medications, and it's very important that you take these at the appropriate time and you continue to take them as instructed. So also part of stage 1, prior to starting your treatment plan, you will most likely be given a pretreatment medication. This may be estrogen and progesterone, or estradiol and progesterone. You may be on the birth control pill. You may be on Provera. You may be taking estrase and Provera. There are many different pretreatment cycles that we can do. And this is to help suppress your body's control of your ovaries. So when we give you all of these medications that we've prescribed for you once you start treatment, we have a little bit more control of how your body responds to them. Obviously, if you have not been through this before, we do not know how everyone's going to respond. We try to predict as much as possible, but that is why these pretreatment medications are given. Some people may not even have pretreatment medications. That is also okay. So once your period starts, we will let you know when to start your medications. Please do not start your medications unless you are told to do so by one of the nurses. For approximately 8 to 14 days, we will monitor your hormone levels. You will have your blood drawn here in the Rochester office. Once the Flint office does open back up, your blood will be drawn there as well, but for now, everyone will be having their blood drawn in the Rochester office, and the blood is actually run here. All the hormone levels are run here, and so that's how we get the results so quickly. We have a machine that does it, and then we will also monitor your follicular growth. So your follicles are what are on your ovaries that house the eggs, and this will be done by vaginal ultrasound. When your follicles, again, your eggs are growing inside of your follicles, are almost mature, you will be instructed to take your ovulation induction medication. This is also called your trigger shot. This is a shot of HCG. And again, later in this presentation, you will get a video on how exactly to do that medication. In most cases, this injection is given 36 hours prior to your egg retrieval. So once you are called and given instructions on when to take your trigger shot, you will also know when you will be coming in for your egg retrieval. So we are going to talk about your treatment plan. Everyone should have a treatment plan mailed to them. If you have not received yours yet, it will come to you in the mail. You may get it at your first scan. We have been closed for a little while here, so we are trying to stay on top of things as much as possible. So again, these treatment plans are individualized for each patient. You may talk to somebody else and they may have a completely different set of medications, or they may have a higher dose of a certain medication. Please know that Dr. Abazid looked through all of the testing that we put you through, all of your previous records, your blood tests, your ultrasounds, and decided what was appropriate for you. So This is not just cookie cutter. It's very individualized for each patient. All of the dates after the pre-treatment section of your treatment plan are approximate dates. We do our best to try and guess based on what quote unquote normal is when everything will happen, but there's a possibility that you respond to medication faster. There's also a possibility that you respond to medication slower. There's a possibility that your period doesn't start when we thought it was going to. So obviously that throws all of the dates off. So please know we are trying to approximate as best as possible, but these dates do change. Your plan may change throughout the process. So when we say this, we mean that the actual amount of medication that you're taking may change. We may tell you to increase your medication. There's a chance we may tell you to decrease your medication. There's also a chance we may say, if you're on 2 medications, we only want you to take 1 of them tonight. This is not abnormal or bad in any way. This is just what Dr. Abazid feels is best for you at this point in time in your treatment. Again, the majority of people are on pretreatment now. We are anticipating a period start date. I know I said this before, but there's no way exactly of knowing when your period is going to start. However, you are given an approximate date on your plan. Obviously, your plan's going to change. I said that earlier, but we are going to try and keep you as informed as possible throughout this process. So if you have any questions while you're going through treatment, or if you want to ask your nurse, how close am I? They will give you their honest answer. Sometimes I've told patients, you look like everything's done. You may not need any more medications, and then they take meds for 2 more days. It all depends on not only your ultrasound, but also your blood work. So it's a big picture that we have to look at. So we will give you our best guess as to what we think may happen, but you will be for sure told what to do every evening. And we will get to that in this next portion. Okay, so this is what everyone's treatment plan looks like, a variation of this. This is actually the Flint treatment plan, so the Rochester ones do look a little bit different. But if you would like to get this out right now and take notes on it, or just so it's clear while we're going through it, that may be a good idea. So I know I touched on some of these, but I just wanted, before we get deeper into your treatment plan, I wanted to go through some of the COVID-19 protocols and changes. We want to keep you as safe and as healthy as possible through this process. Again, I said I know this is a very stressful process without a pandemic happening. So this is compounding stress for you. So what we are doing is, I had said this before, but we used to just do first come, first serve for blood work and ultrasound. You will be given a scheduled visit. When you are called for this visit to be scheduled, you will be screened. You will be asked a bunch of questions. If for some reason you have been exposed, or you have a fever, or you have a sore throat or a cough, please do not lie to us. If you expose us as a group to the coronavirus, there's only one Dr. Abazid. So if that were to happen and he were to be exposed and he were to need to self-quarantine, or if he were to actually get the virus, that would cancel not just yours, but everybody's treatment. So please be as honest as possible. You're not going to be penalized in any way. We are going to work with you as much as possible to, once possibly you are, done with your quarantine, to get you scheduled to go through treatment again. So please be as honest as possible. We want to keep you safe, but we're also relying on all of you to keep us safe so we can continue to help you throughout this process. So you will be screened before you come in. When you come in, you will have your temperature taken. We are requiring actually, that you wear a face mask every single time you come into the office. If you come in and you do not have a face mask, you will be asked to leave to go get a face mask. And then we are going to have to, again, reschedule your appointment. So I'm sure all of you have watched the news, any kind of face covering, a bandana, a scarf. I know a lot of people are making masks now. So whatever you have that covers your nose and mouth, we are asking you to wear that in the office and then wear it the entire time you are there. I know I said this before, but if you do become sick or are exposed and need to self-quarantine, what will happen in that case? So unfortunately, if you become exposed and need to self-quarantine and you've taken medications for 5 days, we're going to have you stop your medications and you're going to, lose those medications essentially. But you're not going to be charged for an entire new treatment plan. So if you were to take your medications and get through your retrieval and somehow after your retrieval you were exposed, what we would do then is we would take your embryos and freeze them and then plan later for a frozen embryo transfer. But again, you're not going to be charged for everything all over again. So we are going to work with you as much as possible if for some reason you do become ill or exposed to this virus. But please be safe. Please stay home as much as possible throughout this process. I know some of you may have big families or somebody that you're taking care of. So just, try and carve out this half of a month for yourself. Stay home as much as possible. We would appreciate it if it was only to the office and home that you were going. I know some people are essential workers and need to go to their job as well, but please, please, please just try and keep us safe, and we're going to try and keep you as safe as possible. Okay, so you can see ART, treatment schedule, and this is with Ganirelix is all this top part means. So your name is at the top. A lot of times your last menstrual period is also at the top. And then your pre-treatment medications. So for this specific person, they were on oral contraceptives from October 26th to November 21st. And then we guessed the approximate start date of the period being November 23rd. I know it says it right there, but I'm going to say it. This is an approximate date. If you do not start on this date, that is okay. If you do not start within 12 to 14 days after stopping this, please call us. So if you call us and you have not started your period 6 days after stopping your pre-treatment medication, we're going to tell you, hey, it hasn't been the 12 to 14 days that we told you. So please wait that full 12 to 14 days and then call us to let us know that you still have not started a period. If you call us before then, that's exactly what we're going to tell you. So there's no reason to call. So you will call the Rochester office. Actually, I know this has the Flint number on it, but you will call the Rochester office. If for some reason you do not have that number, it is 248-844-8845 with the start of your period. Please do not begin medications until you speak with us. So this next part that says note ultrasounds for monitoring in Flint and all that, this is currently during the coronavirus, not part of our protocols. So you will need to call with the start of your period. If you do start your period over the weekend, we ask you to call your on-call nurse. So there is a number for the Rochester office, and there's also a number for the Flint office. If you call over the weekend, those numbers will directly be given to you. I do not have them off the top of my head to give to you right now, but if you do start your period over the weekend, we ask that you call the on-call nurse. And everybody, every time you come in for blood work and ultrasound, will have a scheduled appointment. So we used to just do first come, first serve, and we were open for a specific amount of time for follicular scans and blood work. However, due to the coronavirus, we need to, for your safety, make sure that there's not a ton of patients in the office at one time. So once you call with the start of your period, we will tell you when to come in for blood work and ultrasound. Please do not come before your scheduled time. Please do not come after your scheduled time. If something is happening and you need to reschedule, please call us to let us know. But again, if you do come before or after your scheduled time, we aren't going to see you until your scheduled time. If you come after, we're going to have to reschedule you for either a later time in the day or a different day. So please just try and be as on time as possible to help with the flow of all of the patients who are currently going through treatment. So when you call with your first period, again, we will tell you exactly when to come in for blood work and ultrasound. So after your period, when you do get your period, you'll be instructed on when to come in for your what's called your baseline blood work and ultrasound. Again, it's not between 7 and 7:30. It's not between 6:30 and 8:30. We will give you a specified time when you need to come in for your appointment. I cannot stress this enough that you need to please come in at your specified time. During this baseline blood work and ultrasound, what we're looking for is to make sure that everything looks good for you to start treatment. So we're going to look at your hormone levels. We're going to look at your ovaries, make sure that there's no large cysts on your ovaries or something that could hinder your treatment in any way. And also we're going to look at your blood levels and make sure those all look appropriate for you to start treatment. There is a possibility that at this time we get your blood levels back or something looks off on one of your ultrasounds and we show it to Dr. Abazid and Dr. Abazid says, you know what, I think it would be better if we do one more month of pretreatment and wait. You are spending a lot of money, a lot of time, a lot of effort on this. So we want to make sure that we have the best environment as possible for you to start these medications because we know they are very expensive. So that is a possibility. It doesn't happen all of the time, but I do want you to know that this is something that could happen. So underneath where it says your baseline blood work and ultrasound, you can see where it says fertility medication injection schedule. This is what we're talking about when we say that you have an individualized treatment plan. So we are able to know what the first 4 to 5 days of your treatment will look like. So this person is going to be on 2 medications. They're going to be on Gonal-F and they're going to be on Menopur. Gonal-F, their dose is 150 IUs, which is international units. Sub-Q, which means it's injected subcutaneously, so into the fatty tissue of your abdomen. And then also they are on Menopur 2 powders or 150 IUs. So Menopur comes in individualized vials. Each of those vials has 75 IUs in them. So that's why they are on 2. 75 plus 75 equals 150 IUs. Again, sub-Q. So in the subcutaneous tissue in the fatty part of your belly, injection, and both of these are done in the evening. We want you to do all of your medications in the evening because you are not going to know what medications to take or how to take them until we call you. So you will come in for your baseline blood work and ultrasound. If everything looks good, we will give you a call. We will tell you everything looks good. Dr. Abazid is ready for you to start treatment. This is what we would like you to do. We would like you to go ahead and take your Gonal-F 150 or whatever your dose is and your Menopur 150 or whatever your dose is. We would like you to do that tonight, tomorrow night, Saturday, and Sunday. So I gave her instructions for 4 days. And then we will have you come back on Monday morning for blood work and ultrasound. And again, we will give you a specific time that you need to be in the office for that blood work and ultrasound. So in this instance, the person started their medications on a Thursday. They did them Thursday night, Friday night, Saturday night, and Sunday night. And then they will come back on Monday morning for blood work and ultrasound at their specified time. I did not give them any further instructions. So when they come back on Monday, they will come in for, again, blood work and ultrasound. And after Dr. Abazid reviews that subsequent blood work and ultrasound, you will get a call from the nurse in the evening and they will tell you, okay, Dr. Abazid went over your blood work and your ultrasound, and he would like you to do this medication. It may stay the same. It may change. You may do that medication for 2 days. You may do it for 4 days. You may do it for 3 days. So say Dr. Abazid sees the ultrasound and he wants her to do 2 more days of the medication exactly the same. So I would say, Dr. Abazid looked at your blood work and ultrasound. He would like you to take this medication the same way you've been taking it tonight and tomorrow night, and then come back on Wednesday for blood work and ultrasound. So every time you come in, you will be given very specific instructions on each day, what you should be doing, and then when you should be coming back. Okay, so back to your treatment plan. So after the fertility medication injection schedule, I told you we will call you and tell you when to come back for your blood work and ultrasound. And then the medication I spoke about earlier, the one when I said this medication is given, there's a medication given to help prevent you from ovulating. This is that Ganirelix or Cetrotide. So we will tell you exactly when to take this medication. If you are doing what we call a traditional IVF cycle, you will start this on treatment day 5. This medication will be taken in the morning before you come in for blood work and ultrasound. If you are doing a different protocol, possibly minimal stimulation IVF or mini IVF, this medication will be started when we tell you. So there's protocols that we follow. We will specifically tell you. So again, if you're doing traditional IVF, you will start on treatment day 5, and we will remind you that. But if you are doing minimal stimulation IVF or a different protocol, we will tell you exactly when to start the medication. Either way, we're going to tell you when to start it. So I don't want you to be too concerned about that. But once you do start this medication, you will need to take it in the morning before you come in for blood work and ultrasound, and you will need to do this every single morning until you are told to stop. Do not stop this medication. This medication, if you do stop it or mess it up, this is what could make you, if you stop it, it's preventing you from ovulating. So you could ovulate and then there would be no retrieval, and basically the medications that you've already taken would be wasted. So once you do start your Cetrotide or Ganirelix, we ask that you are no longer having intercourse and that you stop your baby aspirin if this was part of your protocol. Again, once you start your Cetrotide or Ganirelix, no more intercourse, and please stop your baby aspirin if this is part of your protocol. So I know I already said this, but in the afternoon of the second scan, we're going to call you, give you instructions regarding your further injections and when to come back into the office for blood work and ultrasound. We'll continue with this process for approximately 10 to 14 days. Some people are shorter, some people are longer, but you will probably come into the office about 5 times for blood work and ultrasound through this process. Every time you come in for blood work and ultrasound, we will call you. Please do not call us. We will call you once we know what to tell you and how to take your medications. Sometimes Dr. Abazid takes a little longer to get back to us, so your call may not be till a little bit later in the afternoon. If it gets to 6 p.m. and you still have not heard anything, that is when I would like you to call the on-call phone. But generally speaking, we will get to you before then. We didn't forget about you, but sometimes there's unforeseen circumstances and we are unable to connect with Dr. Abazid, but we didn't forget about you. We promise we will call you. Please do not call us. Sometimes we're able to get back to you very quickly, even before noon. Sometimes it takes a little bit longer. So again, please do not call us because that just takes much longer. We will call you once we know what your instructions are. So once you've come in for blood work and ultrasound several times, we will do your HCG injection or your trigger shot. So when your eggs are mature, but before you ovulate, we will instruct you to take your HCG injection or your trigger shot. This is another medication that is extremely important. So mature follicles are generally greater than 16 millimeters. The doctor will decide when the best time for your trigger shot is based on many factors, not just mature follicles. So your age, your diagnosis, what your protocol is, the number and size of your follicles, your hormone levels. These are all things that play into when your trigger shot is. How your uterine lining looks is something also that plays into when your trigger shot is. So I don't want you to think, oh, I have follicles that are greater than 16 millimeters. I should be triggered now. I should be expecting that, because that is not the only thing that plays into it. So please, Dr. Abzid has done this for a long time. Trust his judgment. Something that he did want me to point out to you is just because you have 10 follicles, it does not guarantee that you will have 10 eggs retrieved. Sometimes you have 10 mature follicles and they go in and they get 7 eggs. Sometimes you have 10 mature follicles and they go in and get 12 eggs. So I just, again, want to make sure that you understand that just because you have an X number of follicles, that does not equal. Okay, so as you can see, we're back to your treatment plan, and we have the approximated injection of HCG. So at the beginning, we had the approximated period, and now we've guesstimated when their HCG injection would be. We will call you on the day of your HCG injection. We will give you very specific instructions on how to do your HCG injection. We will give you very specific instructions on when you should do your HCG injection. Again, generally it's 36 hours before your retrieval. So if your retrieval is on Saturday morning at 7 a.m., then your HCG injection will be Thursday evening at 7 p.m. You do not need to remember this. We're going to tell you again very specifically what time you will need to do this. When we do call you with instructions on when to take your HCG injection, again, we're going to give you very specific instructions on how to do it, what time to do it. We're also going to tell you that you're going to stop all of your gonadotropins or your stimulation medications. And we will also give you instructions on when to come in for your retrieval. So we will tell you what time to do your HCG shot. We will tell you that the evening before your retrieval is a surgery. So we will tell you the evening before that not to eat or drink anything before you come in. And we will also inform you that, you will need to take a shower, wash the area, all of the pre-surgical stuff that will be gone over with you when you do get a call for your trigger shot. So you can see on here that we have the 2 days after that, admission to Rochester Hills facility for egg retrieval and semen sample. So on the day of the egg retrieval, this is when the semen sample will be given as well. If the semen sample is going to be done surgically, the male will get a call as well as the female and be given a specific time and instructions for their surgery as well. If we are using a frozen sample, this is something that we will know beforehand. But if we are using a fresh sample that is being produced that day, it will be done that day. Your partner does need to bring a form of ID with them on the day of your retrieval as well. When you do have your retrieval, you will be given instructions on when to return to the office to start when to return to the office, along with when to start your other half of your medications, basically. So you're probably looking at your meds like, well, we covered these ones. There's a lot that you're going to take after your retrieval. So this is your progesterone and estrogen therapy, and that will be given to you at the time of your retrieval. Again, we've estimated the embryo transfer date and the pregnancy test date on this page as well. So we kind of touched on this already, but we're going to move into stage 2 of in vitro fertilization, which is the egg retrieval. So after controlled ovarian stimulation, but prior to ovulation, you will have your egg retrieval. The doctor will go in and surgically remove the eggs from your ovaries. So this is why when we call you, we'll tell you that you have to have nothing to eat or drink because it will be a surgical procedure. You will be put under modified general anesthesia. So you will be completely asleep. You will not remember anything, but you will be breathing on your own. Once you're asleep, the doctor will go in with an ultrasound, a transvaginal ultrasound probe. So the same way you've been having ultrasounds, but then they use a thin needle on the end of it. And through this, they'll puncture the vaginal wall. They will go in and basically pop a hole in the follicle, and they will draw the fluid and the egg from each follicle. So I just want to explain to you how the follicles work. Follicles, I want everyone to visualize a water balloon. The water balloon will represent your follicle. Inside this water balloon, there is a marble. This marble will represent your egg. This marble is adhered to the side of this water balloon until you are ready to ovulate. So the reason we give you your HCG or your trigger shot is to make sure that that marble or the egg is released into the follicle and freely floating. If the HCG injection is done incorrectly or at an incorrect time, it is possible that the eggs stayed adhered to the side walls of the follicle and we are unable to get any eggs from the retrieval. So the HCG injection is very important. We want to make sure that marble is free floating inside that water balloon. So when Dr. Abazid punctures it, he is able to get the egg out of the inside of the follicle. Also, if you do your HCG injection too early or not at your specified time, it is possible that you ovulate before your retrieval. So it's very important that we are following the instructions very specifically as far as when to do your HCG injection. So again, back to stage 2 of this egg retrieval. So after you leave when you leave for your retrieval, after the egg retrieval is done, stage 3 begins right away. So stage 3 is called fertilization. And generally before you leave from your retrieval, we will give you the number of eggs that were retrieved. I know I said this before, but I just want to drive home the point that just because you have 12 follicles, it does not mean that you're going to have 12 eggs necessarily. You may very well have exactly that much. You may have more. You may have less. Please just know that this X does not equal X in this case. So X number of follicles do not equal X number of eggs all the time. The embryologist will then look at the eggs under a microscope and see if they are mature or not. So just because you had 12 eggs retrieved, it does not mean all 12 of those are mature. Okay, so they will need to separate the mature ones from the immature ones. The sperm will be separated from the semen, and then the mature eggs will be fertilized with the sperm through a process called intracytoplasmic sperm injection, or ICSI. With ICSI, a tiny needle will inject a single sperm into the center of the egg causing fertilization. So basically, what we've done in this portion is taken all the work out of it for the sperm, injected the sperm directly into the egg, so the sperm doesn't have to work to get. So what we've done with ICSI is we've taken all the work from the sperm and we're injecting the sperm directly into the egg. The sperm does not have to break through the outer shell of the egg to get inside to fertilize it. The day after your retrieval is considered day 1. So the day of your retrieval, we call day 0. So day 1, on this day, the embryologist will look at the fertilized eggs under the microscope and see which eggs fertilized normally. These fertilized eggs are now considered embryos. You will receive a call with this information. So for just an example, if somebody came in for a retrieval and they had 12 eggs retrieved, when they left on the day of their retrieval, they would know that there was 12 eggs. The day after their retrieval, the nurses will get a report from the embryologist and then we'll call them with the specifics of that report. So your call may go something like this. As you know, there was 12 eggs retrieved. Of those 12, 10 were mature. So 2 of them were not mature. So we do not inject immature eggs. So the embryologist injected 10 of those eggs with sperm. And of those 10 eggs, 9 fertilized normally. So there is 1 that did not fertilize normally. So now there are 9 eggs that we will continue, or embryos that we will continue to watch develop. And that is a great number. Honestly, if you were to end with 9, that's a fantastic number. So immature eggs are not it doesn't mean that we took you too soon or that you did something incorrectly. It just happens. All of your follicles are growing at different rates. Some of the eggs mature faster than others. So there is a chance that you have immature eggs. There is a chance that you have eggs that do not fertilize normally and do not continue to develop. This is just part of the process. After we call you on that first day, you're not going to get a call every day with updates on your embryos. So the embryologist do not disturb the embryos. It's best to keep them in their incubator nice and warm and not disturb them. So we do not give daily updates on the embryos. So stage 4 of in vitro fertilization is the embryo transfer. This will occur on day 3 or 5 days after incubation. So again, your retrieval is day 0. Day 1 is the next day. So day 3 or day 5. On day 3, the embryologist will look at the embryos based on the number and quality of the embryos and you, the patient, that they're going to be transferred into. So if you have something in your history or possibly have gone through this previously, there's a lot of factors that play into when we decide to transfer on day 3. But together, Dr. Abazid and the embryologist will decide on a day 3 or day 5 transfer. So for day 3 transfer, we give you estimated dates on day 5 transfer. We plan for everyone to go to day 5. On day 3, you will be on call. Okay, so we will tell you there is a possibility that we call you on this day and say, Dr. Abazid and the embryologist looked at the embryos and we think it's best that you come in today for an embryo transfer. So on day 3, you will come in for your embryo transfer. If you do not receive that call on day 3, then your transfer will be on day 5. If your transfer is on day 5, you will know in advance what time you need to be here. So if your transfer is on day 3, We do not know for sure the day before that it will be on that day. So you will get a call on day 3 to come in for your transfer. There are some cases where a day 3 embryo transfer is planned. If you are one of those people, then you will be given a specific time. But most commonly, day 3 embryo transfers, we call you the morning of, tell you that we need you to come in for your embryo transfer. You're going to get a time on that day, but you're not going to have a time before then. And we're going to give you instructions on what to do for that day. On the day of the transfer, whether it's day 3 or day 5, the doctor will discuss the quality of the embryos with you, and all of you together will decide on how many embryos should be transferred. So Dr. Abazid will show you what the quality of the embryos look like. He will explain to you age groups and possibly any other diagnoses that you have and what he thinks is best for you, within reason. If somebody has 4 beautiful looking embryos and they say, you know what, I want 4 babies at once, that's not safe. That's not something that Dr. Abazid is going to do. So within reason. The transfer will be done under transabdominal ultrasound guidance. So this is an ultrasound on your belly. So when you come in for your transfer, we will need you to have a full bladder. We also advise you to eat breakfast because on that day you will be given Motrin and Valium, and this is to help relax the uterus during the embryo transfer. We want you to drink a bottle of water on your way in and bring one to sip on when you get here. And we also need you to have somebody to drive you home because you will be given, again, Valium, and we cannot let you drive after we give you Valium. How the transfer is done is a speculum will be placed so that the cervix, the opening into the uterus, can be visualized. And then I believe everyone has probably had what we call a saline sonogram and mock embryo transfer. Jeanette probably did it for you. So what we do is we put a speculum in, then we pass a catheter through your cervix into your uterus. And this is basically done exactly the same way. So a small catheter containing the embryos will be passed through the cervix into the uterus, and then the embryos will be injected into the uterus. The embryologist will go back, check the catheter, make sure the embryos are in the uterus. You will get pictures of all of this, and obviously you will be there the whole time to see it for yourself. So stage 5 of in vitro fertilization is what we call luteal phase support. So even though this is the last stage, this actually refers to the time after the egg retrieval, when your uterus is being prepared for embryo transfer and implantation. But this can continue up until 14 weeks of pregnancy, depending on the patient. So the luteal phase, again, refers to the time after the retrieval, when your uterus is being prepared for implantation. You will be prescribed medication, progesterone support, that will start 2 days after the retrieval and continue it until you are told to stop. Please, please, please do not stop any medications until you are told to do so. Okay? We have seen it where people stop their medications too early, and unfortunately, your body is dependent on those medications to support this pregnancy. So do not stop your medications until you are told to do so. You will be given very specific instructions on when to start your medications. At your retrieval, you'll get a list with everything listed specifically on there. During the luteal phase support, your blood levels will be monitored, and your doses may change depending on your blood levels. So again, I told you at your transfer, you will get specific times to come in for your blood draws. If your blood levels, if you come in for a blood draw after your transfer and your levels look good, or your levels, Dr. Abazid doesn't want to change anything, then you will not receive a call from us. If Dr. Abazi does want to change your medications, then you will receive a call from us. So this will be explained to you again at your transfer, but just to touch base on it now, you will not receive a call if we do not want you to change anything. So when you come in after your transfer, you will not necessarily receive a call every single time you have your blood drawn. Obviously, we are going to call you on the day of your pregnancy test either way, hopefully with good news. And I know I said this before, but this can last up to 14 weeks of pregnancy, depending on the patient. So this next slide is not something that obviously we want anyone to go through, but it is some side effects that we do want to touch on. So side effects of injectable fertility medications. So ovarian hyperstimulation, or OHSS. So we are giving you medications to make your ovaries blow up, basically. They're going to be huge. Sometimes people really respond way more than we are expecting them to. And you have what's called ovarian hyperstimulation. A lot of times we can predict, based on your follicular ultrasounds, who this is going to happen to, but we don't always know who it's going to happen to. There's different stages of it. If you feel extremely bloated, if you feel dehydrated, short of breath, tired, everyone's going to feel a little bloated because, again, we are making your ovaries large. But if you feel extremely bloated and that you can't do anything and you can't walk up the stairs without becoming short of breath, please let us know. There are, again, varying degrees of this. We will monitor you if you do have this. Hopefully no one does. It is a complication, though, with taking these medications. Multiple gestations. So if you transfer 2 embryos, yes, it's possible that you get pregnant with twins. It's possible that you get pregnant with triplets. Identical twins are 1 embryo that splits into 2. So these are all possibilities. Multiple gestation is a possibility. We specifically want you to be pregnant with 1 baby. 1 is safe. We want everyone to have a healthy pregnancy. We don't want anyone to be high-risk pregnancies. So these pregnancies are very precious. But multiple gestation is something that can happen. An ectopic pregnancy or a tubal pregnancy, so a pregnancy where it's not supposed to be. There is a common misunderstanding that when they do the transfer, the embryo just sticks in the uterus. Well, if this were the case, then everyone would get pregnant. 100% of the people would get pregnant. But this is not always the case. So sometimes that embryo either does not adhere to the wall and, there's no pregnancy at all, or that embryo can travel up into the tubes and implant in the tubes. And this is called an ectopic pregnancy or a tubal pregnancy. This is a risk with IVF. This is a risk really to every woman who can get pregnant, but we do want you to know that this still is something that can happen with IVF. Ovarian twisting or a torsion. So I said it before earlier in this slide, we're making your ovaries very big. Your ovaries are not used to this. Your body is not used to this. It is possible that your ovaries twist on themselves. You will have excruciating pain with this. If there is ever a time throughout this treatment that you have excruciating pain, you need to go to the emergency room, please. Obviously, we do want to know about it. Please call us on your way there, but please go to the emergency room. Call us on your way there. We may tell you to go to an emergency room where Dr. Abazid has privileges or has residents there so they can see you. I know this is not a time where you want to be in the hospital, but we also don't want you to jeopardize your future fertility or cause you any bodily harm by not going to the hospital. So if there is any time that you are in excruciating pain or you think something is really wrong, please go to the hospital. Please, please, please. And then there's localized and generalized reactions to the medications. A lot of people might get little welts where they're doing their injections. If you give yourself an injection and you break out in a full body rash, please tell us. If you give yourself an injection and your throat feels itchy or scratchy in any way, please tell us. These are not normal reactions. If you do get a little welt in the area that goes away after time, that is something that is very common. But like I said, the itchy throat and the full body rash, these are not normal reactions to medications. Okay, so that was IVF process explained. So now I am going to go over these consents. I know I said it before, but we are recommending that you schedule an appointment at a bank, go with your significant other to the bank, have these consents notarized. At this point in time, I'm going to tell you exactly where you need to sign them. So these are legally binding documents. They must be signed here in the office. Obviously not now because the setup class is not in person. By appointment, they would need to be done, or you and your significant other may go to a notary to complete them. These must be here by the start of your treatment or your treatment will be postponed. Okay, so we need these here by the start of your treatment. If you start your period 5 days early and you were planning on going to a notary, 2 days later to get these done, what will happen is you will come in for your baseline blood work and ultrasound, that first blood work and ultrasound, but we cannot give you any instructions until those consents are in our hands. They're very important. We need to make sure that you understand what risks you're taking and the process before we give you these medications. So we really need to make sure that your consents are here the day that you start your treatment medications. Okay, so this is what the first page of your consent looks like. There's also going to be a consent mailed to you, just basically explaining that you are going through IVF during the coronavirus. If you're exposed, you'll let us know. We'll have you read that consent and sign it as well. So on this first page, these are all the things that you're going to be consenting through. 2, in vitro fertilization, intracytoplasmic sperm injection, assisted hatching, and embryo freezing. So if we zoom in on this portion of the consents, you can see at the top, it says the patient name, and then the partner name, and the date that you're signing it. So you're consenting to the following. And then you can see it says patient signature on the left, partner signature on the right, and then there are all the lines for you to sign on. So the first line, in vitro fertilization, including your egg retrieval and your embryo transfer. You're going to sign additional consents on the day of your egg retrieval and on the day of your embryo transfer. But this is just saying that you are consenting to go through in vitro fertilization here with us at IVF Michigan, Rochester Hills, and Flint. So both of you will need to sign there. Intracytoplasmic sperm injection, or ICSI. This is the process where they take the sperm and inject it into the egg that I spoke about earlier, that you are consenting to that process. Assisted hatching. So assisted hatching is something that is done on an as-needed basis. So what that is before your transfer, they will look at your embryos, and all embryos have a shell on the outside of them. Sometimes the shell is a little bit thicker. It's called the zona pellucida. This shell can be a little bit thicker, and the embryologist will say, I believe that this would benefit from assisted hatching. So what they do is they take a laser and they basically soften the side of the embryo so that the embryo has a better chance of hatching out of the shell and then adhering to the uterine wall. Again, this is not always done. It's more commonly done in frozen embryo transfers, but it is possible that it's done during your transfer, but this is something that you do need to consent to. Embryo cryopreservation. So if you have, after your transfer, additional embryos, we recommend 100% of the time that you freeze these additional embryos. You may say, well, I only want one baby, or, this is our last time going through this. If you have frozen embryos, it is much easier to go through subsequent treatment. You will not have to take all of the injections again. It will be much less money for you. So we recommend that everybody does do the embryo cryopreservation. There is additional fees involved. However, these fees definitely are much less than going through a complete new treatment cycle. So we do recommend that you do sign yes for the cryopreservation. Obviously, you do have the option of signing no, but we do recommend yes. The next line is consideration for selective reduction. So basically, we want to know if you were pregnant with higher order multiples. So if you were pregnant with triplets or more, if you would consider reducing the pregnancy to what we consider a safe number. So if you would consider selective reduction is what it's called. You would need to circle yes or no. If you were to circle yes, and then the time comes and you were pregnant with triplets and you say, I just can't do this, just because you circled yes here does not mean we're going to hold you to that. We just want to know if this is something that is even something that you consider at all. So again, if you are pregnant with triplets or more, if you would consider reducing the pregnancy to a safe number so for you and the babies involved. And then this last one is for embryo biopsy. PGT is actually what it's called now, PGS or PGD. So if you are doing any pre-genetic screening on the embryos, this would have been discussed before with Dr. Abazid thoroughly in your consults with him. If you are doing this, at this point in time, I would like to say, if you are doing this, you will not have a transfer in the same cycle as you have a retrieval. So if you are signing this bottom line and you already know that you're doing this and you've discussed this with Dr. Abazid, please know that you are not going to have a transfer at the same time that you're having a retrieval. And then you can see where those little stars are at the bottom of every single page. Throughout this whole packet, there's a spot for the patient's initials, so the female's initials, and the partner's initials. Every single page needs to be initialed. The second page of the consents. Basically, this is saying that quality control is very important to us. We like our embryologists to have a lot of practice. Obviously, they do this all the time, but they're always learning. Techniques are ever evolving. So we want to know if you have, say, immature eggs or abnormal sperm or sperm that's not going to be used, if we can use it for quality control. So if they can do things like practice ICSI with it, practice, assisted hatching with it, things like that. These are going to be discarded anyways. The abnormal or immature eggs and abnormal sperm are going to be discarded. So this is saying, yes, you can use this for quality control purposes, or no, absolutely not. It doesn't matter to us either way, but you need to sign one or the other. So you do consent or you do not consent. You can see with stars on either side of it, it says consent signed outside of the practice must be notarized, and the notary stamp goes inside of that box. They are the witness, so the notary can print and sign there, and then the date. So when you go to the notary, all they are responsible for is making sure that you are who you say you are. So if you come to us and your consents are not filled out completely and the notary stamped it, all they're saying is, yes, they were here and they signed this, but if you did not complete it appropriately, that unfortunately falls on you. That doesn't fall on the notary. So please make sure you know exactly what needs to be signed before you go in. And then again, at the bottom of every page, there is a spot for the patient's initials and then the partner's initials. So at the end of the book of consents, after all of the pages have been initialed on the bottom, there's this policy on short-term storage of embryos. So if you're signing yes, that you would like to freeze your embryos, this page needs to be signed. And it just explains the policy on short-term storage. The embryos that are frozen will stay here for 1 year. After a year, they will be shipped to a company called Fairfax. Fairfax is a company that this is all they do. They house frozen sperm, eggs, embryos. This is all they do. It is cheaper for you, for your embryos to be there, and it also allows us to store more embryos. We do not have the capacity here to keep your embryos here for an extended period of time. So what happens is after a year, they're shipped out to Fairfax, and then say you get pregnant with this IVF cycle, you have a baby, and then in a year, when your baby's about 1 year old, you're ready to start trying again. You're ready to go through another cycle, and you're going to use those frozen embryos. All you do is you simply call Fairfax, who you will be in contact with because that's who you will be billed through, and say, I would like my embryos shipped back to IVF Michigan. And it's as simple as that. They will put your embryos on the next shipment and they'll get them back to us and we will plan for your frozen embryo transfer. On these pages, all that needs to be signed is on this page where it has all, you can put your credit card information. None of that needs to be filled out. You do not need to fill out any of the options. All that needs to be signed on this page is simply the female's name, your signature, and the date. You won't have an account number yet because your embryos are not there yet. So that's all that needs to be signed on this page. On the other page where it's in witness, we have signed this agreement on, you would put the date 2020, and then the female and the male, please fill this out completely. So those are the consents. If you have any questions about your consents before you go and have them notarized, please call the office. We'll be able to answer questions that you do have about your consents. So now we are going to move into medications. And there will be videos provided with these medications as well. So medications, your medications are your responsibility. So as we're going through these meds, please make sure that you have all of these. Please make sure you have all of your medications before the start of your treatment. Again, they are your responsibility. We have no way of knowing what you have at home. We have no way of knowing, if you're running out of medication, we have no way of knowing how low your supply is because we don't know what you have at home. We tried to order what you needed to the best of our knowledge, but you need to stay on top of your meds. If you're running low on something, please mention it to us. We'll either tell you to order a refill, or there's always the option of buying meds from us here at the office, but please, please, please pay attention to how much medication you have. If your dose is increased, you're going to go through your medication faster than you would have initially, so you may need more medication faster. So just take some of these things into consideration. Make sure you're keeping a mental note of how much medication you have. Maybe write it down and cross out what you use every day. That might help you, just so you know exactly what you have at home. Please make sure you have enough medications at all time. Again, we don't know what your inventory is like at home. And I said this before, plans change based on your response. We try to order what is appropriate. So there's some pictures of medications on this next page. So these are, a lot of you are taking this medication for pre-treatment now. So the estrase or estradiol, Provera, and then the oral contraceptive pill. I mean, there's thousands different of ways that the oral contraceptive pill looks, but it usually comes in one of these blister packs. So those are the medications for pre-treatment. You will need syringes and needles to give yourself these injections. In the videos, I'm going to explain which syringes and needles you need for each injection, but this is a good slide for you to just kind of take note, make sure you have all of these things. in your supplies. So a 3cc or ml syringe. cc's and ml's are the same thing. You will use this 3cc syringe with basically every single medication that you are injecting into yourself that doesn't come in a pre-filled form. So you're going to use this for your Menopur. You're going to use this for your HCG injection, so that trigger shot. You're also going to use this for your progesterone and oil injections. So you may have a lot of these, but you're probably going to need a lot of them. You will also need a 27 gauge or a 25 gauge half-inch needle. So the gauge is the size of the needle, so how thick the needle is. The bigger the number, the higher the number, the thinner the needle is. So we need these thin, short needles for the subcutaneous injections, sub-Q or SQ. You will need a 21 gauge or a 22 gauge. Some people even get 23 gauge, 1.5 inch needle. So these needles, the gauge is a little bit bigger, so the needle itself is a little bit thicker and it's longer. And these are for the intramuscular injections, so the injections that are actually going into your muscle. So these are not sub-Q, these are going into your muscle, so the needle is longer. So the thicker and longer needles are for intramuscular injections. 18 gauge needles are generally pink. These are for mixing and drawing up medication. Please do not inject yourself with an 18 gauge needle. It will hurt. You will know that you did something wrong. It's not going to harm you in any way, but it's much more painful than it needs to be. If you are getting Menopur from inside the United States, which I believe most people are ordering their medications from inside the United States right now, just because everything that is happening, you will get a Q cap to mix the Menopur with, and that will be shown to you in a video. And then if you're getting medications from overseas pharmacies, you will either be ordered, and if you do not have them, please say something to us. You will need filter needles for mixing the Menopur. And again, in the video, when I do show you how to use the ampules, you will see why you need that. Okay, so subcutaneous injections, the one with the little short needle. Menopur, Gonal-F or Follistim. These medications are interchangeable. So a lot of times people are taking Menopur and Gonal-F or Follistim together. Some people may not be taking Menopur. They may just be taking Gonal-F or Follistim. But these medications are the subcutaneous injections that you will be giving yourself to stimulate your ovaries. So these are the gonadotropins, again, that you will be injecting into yourself in the evening to stimulate your ovaries. Your dose is specified, and what medications you are specifically taking are specified. Gonal-F and Follistim are interchangeable. Sometimes your insurance covers one but not the other, and that is why you may have a different one. Again, they're completely interchangeable. We will show you how to use both of them in a demonstration video. And then the Cetrotide or the Ganirelix. So these medications, again, interchangeable. This is the medication that prevents you from ovulating before we are ready for you to ovulate. So this is extremely, extremely important medication. This is the one you take in the morning before you come in for blood work and ultrasound, so you do not ovulate before we are ready for you to ovulate. These are interchangeable as well. The Ganirelix, I don't know if you can see these pictures really well, but the Ganirelix comes in a completely pre-filled syringe. Basically, all you have to do is take the cap off, clean your skin, and inject it. The Cetrotide is a medication that will need to be mixed. We want you to learn both because you may have Ganirelix, and if you run out of Ganirelix and need to buy something from us, we have Cetrotide here at the office to sell you. So please watch both videos on how to please watch the video on the Cetrotide on how to mix it so you do know how to use it and you don't come to the time when you're ready to give yourself an injection and have no idea how to use it. Okay, so how to do a subcutaneous injection. The first thing you're always going to do when you do an injection is please clean the area that you're going to be using, and then make sure you wash your hands, which I know is like drilled into everyone's heads right now, but please wash your hands before you give yourself an injection. You're going to use an alcohol swab to clean the area where you will be giving yourself a shot. All of your subcutaneous injections are going to go in your belly, unless otherwise specified. So if you draw a 1-inch circle around your belly button, it can go anywhere in that subcutaneous tissue. So 1-inch circle, and then outside of that 1-inch circle, that's where it's all going to go. We want to keep it in that 1 to 2 inch area. Rotate where this injection site is. The chances of you injecting in the exact same spot 2 times in a row is very slim to none, but try and rotate every other side. Again, use an alcohol swab to clean the area. You will gently pinch the skin around your belly button and insert the needle into the skin at a 90-degree angle. Okay, so that's our instructions. You will always be injecting at a 90-degree angle. After you insert the needle completely into the skin, you can release your grip on the skin, inject all of the solution by gently pushing down on the plunger, and then you will withdraw the needle and the syringe, and then you may press an alcohol swab or gauze swab on the area just to kind of help massage in the medication that was given. I don't want you to think that if you held, if you squeezed the whole time you were giving the injection and you didn't loosen your grip on the subcutaneous tissue, something's going to go wrong. It's not. So, these are the specific instructions on how to give a subcutaneous injection. There's a lot of videos online on just how to give a subcutaneous injection, not even how to give like a fertility medication injection. But I have full confidence that all of you can do this subcutaneous shot. Watch a bunch of YouTube videos. Normally we let you practice into a little stress ball. Unfortunately, right now we can't do that because you're not in the office, but try and get as comfortable as possible with it. So again, we're going to move on to intramuscular injections or IM injections, and these are done with the bigger needle. So the intramuscular injections are that very, very important HCG shot, that shot that releases the marble from the side of the water balloon. So these are either called Novaril, Pregnil, or you may have something called just HCG. These come in different dosages. Most people are going to take the 10,000 units of HCG. The other intramuscular injection is progesterone and oil. You will have progesterone and oil as your part of your luteal phase support. So after your retrieval, you will take this if you are over the age of 35, or if for some reason Dr. Abazid has prescribed it to you, we will tell you specifically if you are under 35. Lately, people have been requesting to take this medication instead of other medications. So if you are one of those people who chose to take progesterone and oil, that's fine too. But I just want to point out that not everyone is taking this progesterone and oil. You probably, if you are under 35 and are going through treatment, you have another form of progesterone support. So intramuscular injections, again, make sure you wash your hands, start with a clean area. Your intramuscular injections are going to go into the upper outer corner of the buttocks. So we will give you a very specific diagram as to where they will go. But if you are to stand with your hands on your hips, fingers facing forward, it's basically where your thumb falls. And I know it feels like your lower back, but it's kind of going to be below or possibly where your pants sit. But it is above your butt crack, actually, and then in the upper outer corner. So it's a big, big muscle there. How you're going to do this is you're going to hold the skin and the muscle now firmly, and you will inject at a 90-degree angle, straight up and down, in a quick, firm motion. So we kind of demonstrate it like you're throwing a dart. So make sure you go all the way through, quick and firm. It's much easier than going slow through. And I'm sure that most of your significant others will be doing this injection, and they're going to tell you if you're doing it wrong. So after you insert the needle, you can completely release your grasp of the muscle. we want you to gently pull back on the plunger. So you're going to put the needle all the way in. The needle's going to stay in. You're going to pull back on the plunger of the syringe to make sure you get an air bubble. If blood appears, when you pull back, you will simply pull the needle out like 1/4 of an inch, pull back on the plunger again, and you should get an air bubble. If you do this again and blood appears, then we're going to have you remove the needle and you're going to start over on the other side. This medication is not contaminated. If you do get blood in it, it's not contaminated. It's your blood. So what we'll have you do is we will have you switch the needle to just a sharp needle again because it did go through your skin, and you'll start on the other side. This very seldomly happens, but it does happen from time to time. So if you do, again, we'll switch the needle. You'll inject it into the other side, so the other butt cheek, and you will pull back on the plunger, get an air bubble, and then you will inject the medication. You'll push steadily down on the plunger and then withdraw the needle and press where the injection was given. It says with an alcohol swab, but I would recommend using a piece of gauze and just try and massage that in. When you're giving progesterone and oil injections, unfortunately, they are a little bit, it is oil, so it's more viscous. And so the injection does go a little bit slower. We recommend using a warm compress before and after because it is oil. Just like if you were to heat oil up while cooking, it does become less viscous when you heat it up. So if you inject it into a warm area and then massage it with a warm compress after, it generally helps just with the absorption of that medication. Again, I kind of said you're going to have all these medications. You're going to be like, what are all the rest of these? So there are luteal phase support medications. So everyone gets 2 forms of progesterone. You're going to have either endometrin or crinone. These are interchangeable. Again, most people will have endometrin. It is what is preferred. Crinone is completely fine too, though, if that's what your insurance covers. Crinone sometimes just gets a little more goopy. And then you will also be given estrase vaginally. This is the same medication you may have been taking orally for pretreatment. So it's a little blue pill. You can see it right there in the upper right-hand side of those pictures. Again, this is the same medication that you were taking orally for pretreatment. If you did take it, or possibly you took it orally before for something else, we are having you insert it vaginally. You will be taking prometrium if you are less than 35, and progesterone and oil if you are over 35. And then everyone will be given an antibiotic. The antibiotic is the only medication that you will start on the day of your retrieval. Okay? So you're going to be on that for 5 days. The antibiotic is just a prophylactic antibiotic just to make sure you don't get an infection. So we are going to show you our videos. Please reference your mixing administration of your medications from your book. There are other sites that have medication mixing instructions and demonstrations. Here is one of them, the freedommedteach.com. That's good for preparation and administration. Please make sure that you are comfortable doing this before it comes time for you to do it. So I don't want you sitting there the day that you take your HCG injection and saying, oh my gosh, I'm not comfortable. I don't know how to do this. We're going to call you. We're going to explain to you on that day, but please familiarize yourself with how these medications are supposed to be given before you are doing it. If you looked in your book and you went to the websites and you still don't know what you're doing, call the nurse. That's what we're there for. Call the office. If it's after 4 p.m., you'll be speaking to the on-call nurse, but we want to make sure that you do get your medication done correctly. These are all the medications that we just went through: the Menopur, Gonal-F or Follistim, Cetrotide or Ganirelix, and then HCG. Okay, so the first drug that we are going to show you how to use is going to be your Menopur. This is one of the drugs that you will use during your stimulation period. We will instruct you on when to start this medication, and again, your dose will be specified by Dr. Abazid. So what we're going to show you is what you need to give the injection, how to mix the injection, and then actually demonstrate how to do the injection once everything is mixed. Okay, so to start with this injection, first of all, this is what your Menopur looks like. Obviously, this says Menopur on the side. When you open it, there will be, obviously this is not completely full, but your Menopur is on the bottom, and on the top, this is actually just saline solution that you're mixing your medication with. Each one of these ampules has 75 IUs or international units in it. So if your dose, if we tell you to take 75 of Menopur, then you will only need 1 powder. If we tell you to take 150 of Menopur, then you will need 2 powders. It doesn't matter how many powders you use, all you need is 1 of these salines. So you will have a lot of the water left over once you are completely done with your medication. Also, you will need a 3 cc syringe or a 3 ml syringe. CCs and mLs are the same. Also, in your Menopur box, you will get Q caps. If you order your meds from overseas, you will not get Q caps because your Menopur will come with ampules. We do not have that to demonstrate. At a later time, we will demonstrate, but today we'll be going through with the Q cap, which fits right on the end of the 3 cc syringe. And then you will need 25 to 27 gauge, and it's a 1/2 inch needle. So it's a very small needle. I'll show you it when I open it. So to start, we're going to clean our hands. I'm going to demonstrate 150 mixing that dose. So you'll clean your hands obviously before you do any injection. We're going to open the 3 cc syringe, and then we will place the Q cap on the syringe, which isn't always easy. There you go. Okay, so this just screws completely onto the syringe. Off, on. It just screws right on and off. Okay? So with this now, you're going to take your saline. Everyone's medications come with a cap on them. So this cap needs to come off. So we will take this cap off. We are going to advise that everybody cleans everything. So even though I just took that cap off, I'm going to clean the top of this with an alcohol swab. I'm going to place it on the table, and then I will stab the Q cap through the rubber stopper and into the saline. Completely turn everything upside down. You'll pull the saline solution out to just 1 cc. That's all you need is 1 cc of saline. So if you can see on this, the stopper is at the 1. That is all the saline you'll need, again, for mixing however many vials of Menopur you'll need. Then you'll simply take this off, and now for demonstration purposes, we do not have full Menopur. Menopur will come with a white powder at the bottom, and that is the medication. So it will look like this with a little white powder on the bottom. That powder will dissolve immediately. For demonstration purposes, these ones are empty. But then you will take the saline solution, the 1 cc of saline solution, and you will again stab it through the rubber stopper on the top of the first vial labeled Menopur. You will inject the saline solution. Everything should dissolve immediately with Menopur. If it's not dissolved, simply very gently swirl it around. Again, you will invert it, and then you will pull all of the medication out. This time, make sure you get everything. If there's a bubble on the top, it's no big deal. We'll get that out later. Then you will take the Menopur off. So that's 75. Now I have 75 international units of Menopur in here. So now to make it 150, I'm going to take this solution and inject it into this Menopur. So again, through the rubber stopper, push everything down. It will dissolve immediately. Invert everything and then pull everything back out. The Menopur will come off. So now there is 150 because we used 2 Menopur vials. So at this point in time, we have our medication in our syringe and we are ready to do the injection. So what I'm going to do is simply take the Q cap off, This is a sharp, so please dispose of it in a sharps container. If you do not have a sharps container, a 2-liter will do, and you can bring it to your local pharmacy and they will dispose of it appropriately. At this point in time, I am going to take the 27 or 25 gauge needle, 1/2-inch needle, and again, this just simply screws on to the syringe. Okay, and I just want to show you guys, this needle is very tiny. So once you have this needle on, we're going to get the air out of the syringe. So you're just simply going to push up the plunger, and then you'll get a little bubble coming out of the top, a little drop, not bubble, I'm sorry. But once you see all the air's gone, just very gently. Okay, so you can see that one drop. So now I'm ready to give the injection. So this is a subcutaneous injection. It will go in your abdomen around your belly button. So there's a 1-inch circle. If you drew a 1-inch circle around your belly button, you can do it anywhere in that area. So simply, for demonstration purposes, again, you're going to clean the area with an alcohol swab. You will pinch the skin, and at a 90-degree angle, you will inject the medication. So you will push the needle through, push the plunger all the way down, make sure it is completely empty, and then pull back. Okay? You may or may not have bleeding with this medication. Most people tolerate the Menopur really well. Some people complain of a little bit of stinging, but other than that, there really shouldn't be any side effects. You may have some local irritation that should go away within a few hours. Again, if you have any side effects that are listed, please let one of the nurses know so we can evaluate and possibly change your medication or just monitor you more closely. Okay, so earlier I said that we didn't have ampules to show you, but we do. So I'm going to show you how to do your Menopur with an ampule. So the ampules come like this. They are little vials filled with water, and as you can see, there's that blue dot on the top. So I just want everyone to take note, if you are going to use the ampule, of that little dot. So how you're going to do this is, first, I would like you to get everything ready. So you're going to need a 3cc syringe. You will need a filter needle. So we will order these from the pharmacy for you, or you will need to get them from us, but please let us know if you do not have a filter needle. Okay, so you're going to put the filter needle on the syringe, leave the cap on, please, and then make sure you open both of your Menopur vials and clean the tops of them. Okay, so now we are ready to actually mix the medication. So to mix this medication, you will need to first open the ampule, which is the scary part for most people. So we'll have you either take an alcohol swab, or you can take a piece of saline, and you're going to put your thumb on that little blue dot that I talked to you about earlier, okay? So I'm simply holding it like this. You'll hold the bottom, and then you're going to push on that blue dot and break the top off. So as you can see now, it's in 2 pieces. Here's the top portion, and here's the bottom portion, okay? All of the saline is in here now. So because we just broke glass, that is why we have you use the filter needle. So you will then take the cap off of the needle and simply put the needle into the water and pull out 1 cc of water. Okay, as you can see, there's a lot of air that time, so I'm just going to push some of the air out before I start mixing the Menopur. Lost a little bit of water, that's no big deal. Okay, so now all of my water's in here, and I'm still using the filter needle. So I'm going to do 150 of Menopur, so again, each of these is 75. So I will inject it into the first vial, make sure the powder at the bottom dissolves. Make sure the needle is below the level of the water. Pull all of the medication back into the syringe. And then I'm going to inject it into my second vial of Menopur. Make sure everything dissolves. Pull all of the medication back into the syringe, making sure that the needle is below the level of the water. Okay, so I do have some air in here. I'm going to push just most of that air out, and then I'm going to switch the needle. So I'm going to take the filter needle off, and I'm going to replace it with the sub-Q injection needle. So this is the 25 to 27 gauge 1/2 inch needle. Okay, it looks like this. And then now I'm actually ready to give myself the injection. So you'll get the air bubble out of here, maybe very gently. And then you will clean the area around your belly button, squeeze, push it through the skin, push the plunger all the way down, make sure there's no medication left in the plunger, and pull everything back out. So the rest of it still goes the same, it's just the mixing portion that is a little bit different. I know the ampules seem scary, but they're very usable. So if you have any questions about them, there's also like slowed down YouTube videos where you can watch people do this in slow motion if you would like. Once you do it one time, it really does come much easier. If you do need practice, you can use one of yours because you will not be using these every single time you do an injection. So you will have extra ampules, so go ahead and just break one open before you do your first injection. So the next medication that we're going to demonstrate for you is Gonal-F and Follistim. These medications can be used in conjunction with Menopur throughout your treatment. You may be on just this medication. Again, you have a specific treatment plan for you, so make sure you are following that along with the instructions given to you by your nurse. These medications are interchangeable. You could use one for 2 days and another one for 2 days, but most of you will just be using the Gonal-F. Some people will get Follistim, and at the end of the video we will demonstrate how Follistim is a little bit different, but these come in pen form. It will come in a box with this pen inside and then a bunch of these, and these are all little needles that you'll screw on, which I will demonstrate in the later portion of the video as well. This medication is fairly simple to use. If anyone has used an insulin pen before, this medication is very similar to using that. So we will demonstrate how to use this for you at this time. The medication we're going to show you to use is called Gonal-F. A lot of you have Gonal-F, some of you may have Follistim. The premise of the medication is the exact same. They're interchangeable. If you needed if you had Follistim and you needed to buy Gonal-F, we could use them interchangeably. They do work a little bit different, so again, we will show you how at the end of this video. So this is also a subcutaneous injection. You will use this along with the Menopur. Some of you may not use Menopur and you may just use Gonal-F, so whatever. Again, your specific treatment plan says to you. For this medication, it will come in a box. We don't have the full box to show you, but it will come in a box with a bunch of these, and these are actually needles. These are what you will use to give yourself the injection. So if any of you have used an insulin pen before or been around anyone who's used an insulin pen, this is very similar. So with this pen, if you simply take the cap off, you can see that the medication is in here. Okay? The pens come in different dosages. Some come with 300 units, some come with 450, and some come with 900. So you just need to know what your pen is to know how many dosages you could use. So for example, this pen has 450 in it. So if I was on 150 units of Gonal-F, I could use this pen 3 times. There is overfill in every pen. Say I used this pen 3 times and I saw that there was a little bit more, you're welcome to try and use that. Just know that you may not get the full dose. If you don't get the full dose, it will say what you still need to give yourself in this little window, which is kind of hard to see, but this is where the dosage you will dial to. So to do this injection, obviously you're going to clean your hands first. Simply take the cap off of this medication. This is one of the big ones. Make sure you're cleaning it really well because you will be using this over again with the Menopur. Those are all single use, so make sure you are cleaning this. Simply take the bottom portion off of the needle, and then this will screw onto the top. Please be careful because once you take this part off, there is a needle on the inside of that as well. So now we have the whole pen put together and we're ready to prep the medication to give it. So again, I told you that I was going to take 150. There is a window on everyone's pen. I know that you can't see this window right now, so I apologize, but I'm just going to simply spin the dial and I'm going to dial it to 150. Okay, so I went past 150. No big deal. I'm simply going to turn it back. So the inside the window says 150, okay? So whatever your dose is, whatever they told you to take, inside the window, that is what it should say. So now this injection is ready to go. That's all you have to do for this. So for the next portion, you will take the plastic cap off, and then under here is where your actual needle is. So you'll take this portion off too. Again, this is a very tiny needle. The injection will be given exactly the same as Menopur. So you'll clean the area on the skin. Gotta switch hands because I'm not left-handed. You'll squeeze, stab through the skin, make sure that the entire needle is inside, and then you'll push down on the plunger. We recommend counting to 5. 1, 2, 3, 4, 5, and then you can pull everything out. When you are done with this medication, the window should read 0. If the window does not read 0, then you either didn't have enough medication in your pen to give yourself the full dose that you needed, or you did not hold it down long enough. So if I didn't hold it down the plunger down long enough, and this window said 25, then I know that I still need to give myself 25 units of this medication because I did not give myself the full dose. So works the same if you do have overfill in your pen. Dial it to your dose, give yourself the injection, count to 5. When you pull it out, if there still says a number in the window, then you'll know that's how much you need to give yourself from the next pen. So that is actually all of the Gonal-F. You can simply get rid of your needle in a sharps container and then recap it, and you can use this again for your next injection. And so the only difference between Gonal-F and Follistim is Follistim comes, the pen comes actually separate, and Follistim is a little more green in the sense that you're going to use this pen the entire time, but the pen is actually completely empty. So the pen's empty and you'll get a box of actual medication. This is for demonstration purposes only. And this is what it'll look like. So this is actually the Follistim in here. So every time you give yourself your injection, these come in the same dosages though. So this vial may be used again 3 times. This is 450. You'll use this 3 times. So to load this in here, you'll simply take your pen completely apart, and then you will push the medication onto the top of the pen and screw it back together. These have windows as well, so you can see maybe this window a little bit better, probably not. It's the one sunny day we've had in Michigan in 4 weeks. And it's ruining our video. Okay, so the only difference is for this medication, it does need to be primed, where Gonal-F did not. So if you have Follistim, you'll need to simply dial this just 1 tick, and then once you have your needle on, you'll push it down. Okay, now you're ready to dial to your dose. Again, you'll dial to, my dose was 150, so I'll dial it to 150. I'll take off both layers of the needle, very small needle again, and then you'll do the injection, squeeze the skin, make sure you're clean with the alcohol swab, and then push all the way down. Count to 5, remove everything. Again, make sure that the window says 0, and then this ampule was a 450, so I know that I can use this 2 more times for injections, and then once that ampule is done, you will simply take out this ampule and then replace it with another one. So that is the only difference between Follistim and Gonal-F. but the premise of the medication is the same. And again, they are interchangeable. So if for some reason you were unable to get one, but you could get the other, I don't want anyone to get upset or freak out because we can use them interchangeably. Demonstrate for you is Cetrotide or Ganirelix. This is the medication I spoke earlier about. This medication will prevent you from ovulating before we are ready for you to ovulate. So we're giving you all of these medications to produce a lot of follicles. Your body's like, what's happening? We need to get rid of some of these follicles. This is going to prevent you from ovulating. So this medication is very important. This medication, again, needs to be taken in the morning before you come in for your scan. Try and take it at the same time every morning. We will tell you exactly when to take this medication, when to start this medication. Please do not stop this medication until you are told to do so, along with all of your medications, but this one's extremely important. So if you're going through a traditional IVF cycle, this will be started on treatment day 5. If you are doing a minimal stimulation cycle, this will be given at a time decided by Dr. Abazid, but we will let you know when that time is. Again, once you start this medication, you will take it every single morning until you are told to stop. You will take this before you come in the morning and make sure you're trying to keep it around the same time every day. Cetrotide and Ganirelix are the two medications that are used for this. They are, again, interchangeable. So if you have Ganirelix, it's a little bit simpler to use. We're going to show you how to use the Cetrotide right now, and then I'll explain how to use the Ganirelix as well. After you're able to do the Cetrotide, the Ganirelix will be no big deal for you. Okay. So this is how your Cetrotide will obviously come in a box, but you'll pull this little portion out of the box, and inside here will be a syringe, and this is simply filled with saline. Okay, there is no medication in this syringe. This is just saline. There will be 2 needles. You can see one of the needles is big. Ugh. Okay, this is for mixing. The other needle is small. This is for injecting. This will also be a subcutaneous injection. Again, 1 inch around your belly button. You can give it in any of those areas. Obviously, you're going to be rotating these spots throughout your treatment. And then the last thing that comes in this little pack is the actual medication. And it does come how the Menopur comes in a powdered form. Okay? So for this medication, how we use it is, again, this is just saline in here. So you will take this cap off and you will screw on the big needle. Okay, so in this case it's yellow. I'm not sure if all of yours will be yellow as well. You will take the plastic covering off of the actual Cetrotide and then clean this with an alcohol swab. You will then take this big needle again for mixing. Make sure you hold this on a flat surface. Push the needle through the plunger and inject the medication into the powder. I'm not sure if you could see that, but this dissolved immediately. There is some flux in there, so what I'm going to do is I'm going to take this off, put the cap back on, and then I just want to make sure that all of this dissolves completely. Just going to swirl it around a little bit. You never want to shake your medication because you can see there's already bubbles forming in here. So if you were to shake it, it would be a ton of bubbles and then you'd have to wait to give yourself the medication. So I just want to make sure all the little white flecks are gone. Gently shaking it. So it appears that everything is mixed now. So I'm going to take the cap off the needle and then I'm going to again push the needle through the plunger. Then I'm going to invert everything. Now, when you do the inversion, please make sure that the needle is below the level of the water. If you have it above the level of the water, you will just be pulling air back into your syringe. So once the needle is below the level of the water, so the needle is almost all the way completely out. you will start pulling the medication back into the syringe. Now this is a little difficult because it creates a vacuum. So you're gonna have to hold pressure on the syringe while you're pulling the medication back in. Okay, so now you see that this is completely empty. There are still some bubbles in there, but that's not really going to be that big of a deal. I'm going to take this needle off, so put your cap back on very carefully. Remove the long needle, and then you're going to put the little needle on to give yourself the subcutaneous injection. This medication as well, you will push all the air out of it until you see a little bubble, a little droplet on the top. Just make sure you don't have any air. If you do inject yourself with some air, I don't want anyone to think that this is going to harm them in any way. Okay, so now the medication is ready to use. So again, you'll clean the area 1 inch around your belly button, squeeze, make sure the whole needle goes in, and inject the medication. This medication, for some reason, does seem to give people a little bit more burning and stinging and local irritation, so I don't want you to be alarmed if that does happen, but I do want you to keep an eye on it. If you were to be given Ganirelix instead of Cetrotide, how Ganirelix comes is in a pen just like this. However, the medication is in the syringe, so it'll be completely mixed, ready to go for that medication. All you need to do is take the top off. You'll get the bubble that's in there out of the medication, and then give yourself the injection. That one's very simple. There's no mixing needed. The Cetrotide is a little bit more labor intensive, but not too difficult. Okay, so the next medication that we're going to show you how to use is comes in many different names. So you may have something called HCG, you may have Navaril, and also you may have Pregnyl. So for this injection is very important. This injection is given to you before your retrieval, when we're ready to schedule your retrieval. And what this medication does is it releases the egg from the follicular wall. So when Dr. Abazid goes in to do the retrieval, he is able to take the egg with the fluid inside of the follicle. If you were to do this medication incorrectly, it is possible that when he does go in to do your retrieval, there will be no eggs at all retrieved. So it's extremely important that you do this correctly. I'm going to explain it to you now. On the day of your injection, you will be given very specific instructions again as to how to do your trigger shot and what time to do your trigger shot. So make sure that you are paying very close attention, taking good notes on that day, and that you understand everything completely. And if you don't understand, please ask your nurse at that time. For this, you will need if you have Navaril, you will need 2 of these. You will need a 3 cc syringe again, and then you will need 2 intramuscular injection needles. So these are 1.5 inch needles. They can be anywhere from a 23 to a 21 gauge. So 22 gauge as well. That's actually what I have here, and it's a 1.5 inch needle. Some people do get a 25 gauge 1.5 inch needle. That's fine. The injection will just go a little bit slower. So we will show you how to mix this medication and give yourself this injection at this time. Okay, so for this medication, again, you may have something called HCG or chorionic gonadotropin, okay? And this comes in 10,000 units. So you can see it says 10,000 units on here. Maybe you can't see, but please read your medication. If you do have Navaril, this comes in 5,000 units. There are some, very seldomly, we will get people who do get 10,000 units of Navaril, but if you do get Navaril in the 5,000 unit form, you will need 2 of these because most commonly your dose will be 10,000 units of HCG. Again, that will be an instruction given to you on the day of your trigger shot or the day of your HCG injection, same thing. So make sure that you are paying close attention. But if you do have Navaril and it's 5,000, again, you will need 2. So for this medication, it will come in a box with the powder and the water. You will get a giant thing of water. There will be 10 cc's of water in here. And then there will be a powder at the bottom of this. Obviously there isn't one in this for demonstration purposes, but just how the Menopur comes, there will be powder at the bottom. So we're gonna need to mix this medication before it is injected. So I'm gonna get all of my supplies ready. Again, I have the 3 cc syringe and 2 of the intramuscular injection needles. So I'm going to open the syringe and the needles, and then I will also take the plastic caps off of these. Make sure that you clean everything. First, you'll screw one of the needles on. I'm so sorry. That's okay.
Okay, if you could just start this up.
I know it's pinching. Okay. So first you will take one of the needles and screw it onto the syringe. Again, this is simply done just like that, okay? And then you will take the protector, the plastic cap off the needle. So first we are going to get water. All you need from this 10 cc vial of water is 2 cc's of water. So I'm going to take my needle, push it through the stopper, invert everything, and then make sure again the needle is below the level of the water, and then I'm going to pull 2 cc's of water out. Okay, so now I have my water in here, 2 cc's, and now I'm going to inject it into my HCG. So this is 10,000 units of HCG. Make sure you clean the top of your stopper, push the needle all the way through, inject all of the water that you had pulled into the syringe, and then what I'm going to have everyone do is completely remove the needle and the syringe. Carefully recap your needle, and then this medication does not dissolve as easily. So we want you to simply roll it between your hands and swirl it gently, roll it between your hands. Please do not shake this medication. If you shake this medication, you will have a vial again full of bubbles, and you need to give this medication at a very specified time, and if you have a vial full of bubbles at that specified time, you're not going to be able to give yourself the injection. Okay, so again, make sure everything is dissolved, there's no white flecks in there. You will take your needle, take the cap off again, and you'll push it through the plunger, invert everything, flip everything upside down, and then make sure that you again have the needle below the level of the water. Please make sure you have the needle below the level of the water. Make sure you pull everything that's in this vial out, as much stuff as you can. Okay, so now I have my injection. So I have 2 cc's of medication in here. Now, if I were to have Novaril, this would have only been 5,000 units, so I would need to take this and inject it into a second powder and make sure everything dissolves and pull it back in for the full 10,000 units. This was 10,000 already, so I did not need to do that. Now this is the first intramuscular injection that everyone will be doing. So for this, we are going to switch the needle. So this needle went through the stopper 3 or 4 times, so this has now been dulled, and you do not want to inject yourself with the same needle. So we're going to take this needle off, and we're going to put a fresh needle on. Again, you're going to get the air bubble out of the top of the syringe. This injection goes into the upper outer corner of the buttocks. We will put demonstration picture as to where it should go. There are also many demonstration videos on many different websites. The pharmacy that you got your medication through probably has demonstration videos as well. So this medication again will go into the upper outer corner of the buttocks along with all of the other intramuscular injections. So you will take the needle off, the needle cover off, clean the area of the skin. You're going to, your spouse or your significant other, whoever's giving you this injection, will pinch the area that you're giving it in. Make sure before you were pinching kind of your fatty tissue, now you're going to be pinching your muscle. So you're going to pinch the muscle, inject quickly, and then you are going to pull back just a little bit on the syringe to make sure you get a bubble. If you do not get a bubble and you do get a flash of blood, what we're going to have you do is pull out just a touch, okay, and then pull back again, and at that point in time you should get a bubble. If you again do not get a bubble and you do get blood, we're going to have you pull out completely, take the needle off, and then start over on the other side. The likelihood of this happening is slim to none, but I just want to put it out there. So again, you're going to squeeze the muscle, inject straight in, pull back, make sure you get that air bubble. Once the air bubble is there, you're going to slowly inject this medication. Make sure it's completely empty, and you're going to pull this out. These ones are more likely to bleed, so you might want to put a Band-Aid on that or hold pressure on that area. Please dispose of your sharps appropriately in your sharps container, and then after this medication is given, you will have a time for your retrieval, so just make sure that you are doing this again at the specified time you had been told before. The next medication that we're going to be demonstrating for you is called Progesterone and oil. This medication will be part of your luteal phase support, so this medication will be started after your retrieval and before your transfer. Again, we will instruct you when to start this medication and how you will be starting this medication. Not everybody will be given this medication. If you are one of those people who aren't taking this med, lucky you. This medication is obviously an oil, and it's going to be an intramuscular injection, so it's a little bit more painful, but you will start this medication when you are told to, and then you will continue it again until you are told to stop. So we will demonstrate how to use this medication. You'll need a 3cc syringe. The 3cc syringe is just what you're going to need all the time, basically. For this medication, you're going to need a bigger needle, so an 18 gauge, 1 or 1.5 inch needle. It really doesn't matter how long the needle is, but we do need it to be a bigger gauge. So the gauge is the size of the opening of the needle. We do need to be bigger. And then you will need a 23 to 21 gauge, 1.5 inch needle to actually give yourself the injection with. So now we will demonstrate how to do this injection. Okay, so progesterone and oil simply comes in a box by itself, and then it has one of the caps on it. So to get ready to give yourself this injection, again, you'll need the 3cc syringe, and we're going to start with the 18 gauge needle, so the big needle. So put that on your 3cc syringe. You will take the cap off of your progesterone and clean your progesterone. So for the progesterone and oil, most of you will be on 2 cc's or 100 milligrams. So you can see that for every ml or cc of liquid, there is 50 milligrams in it. So you will need 2 cc's to equal 100 milligrams. So for this medication, something I'm going to instruct you to do is fill your syringe with air first. So I simply put on the 18 gauge needle and pulled back the syringe to the 2 cc mark. This will make this medication a little bit easier to come out of the vial for you. Again, you're going to take this plastic cap off of the needle, and then you're going to inject the air into the vial. This is not a crucial step, it just makes things a little bit easier. And then invert it. Again, make sure that your needle is below the level of the oil. And then you're going to pull the oil out of here. It is a little bit more difficult than the rest of the medications have been. And just make sure you're pulling 2 cc's of oil out. And you'll take the needle out, and then you're going to recap this needle. And as you can see, I have 2 cc's of oil in here actually, and then for this you may need to tap it a little bit to get the bubbles out. If there's just some small bubbles, it's not that big of a deal, but try and get all of the bubbles out, and then again you'll push on the plunger to make sure you get that bubble out of the top, and you'll have a little droplet on the top. So now that I'm ready to give myself the injection, all of the medication is in here, I'm going to switch my needle. So I'm going to put on the intramuscular injection needle. So again, 23 to 21 gauge, 1.5 inch needle. Simply screw this on. This again will go into the upper outer corner of the buttocks. This medication for most people will be given every other day, so we recommend that you are switching sides. When you do give this medication, we want you to take the weight off of whatever side you're giving it on. So if you're giving it on the right side, make sure that most of your weight is placed on your left leg so that the muscle is not tensed up. So again, you're going to clean the area that you're giving the medication injection into. And you will simply take off the cap of the needle. Again, whoever's giving you the injection will squeeze, going in a 90-degree angle all the way in, and then this injection is definitely more difficult to push on the plunger, so this will be very slow. As you can see, I'm injecting it right now, and it does take a little bit more time to do. So just slowly be patient. Whoever is doing it for you, tell them to be patient too. You'll inject it until it's completely gone, and then you will pull the entire syringe out. Hold pressure on the area. This also may cause some bleeding, so you may want to put a Band-Aid on there. With this medication, we recommend using a hot compress or a warm towel before and after. This is an oil, so just like if you were to heat oil up, the less viscous it gets. So using a warm compress sometimes helps with the injection process as well as with the pain. Please monitor if you're having any side effects or you think something is abnormal. Please let one of the nurses know. And that concludes our progesterone and oil injection. Some important points. There is the emergency or on-call phone. It's being used a little bit differently during this pandemic. So generally it is saved for emergencies. But again, if you do start your period over the weekend, we used to just have you come in on Monday morning. You will need to call the on-call nurse to let her know that you did start your period so she can give you a time to come in on Monday morning. Your medication instructions. Please make sure that you are clear about what your medication instructions are when you speak to your nurse. You may want to write it down every time. You may want to say it back to her every time. Just make sure that you are clear. If you have questions, ask them. We will definitely answer them. I know I touched on this earlier, but callbacks. We know that you came in for blood work and ultrasound. We know that you need a call. Sometimes it does take us a little bit longer to call you back, just based on timing of Dr. Abazid's schedule, other patients that are being seen. So please know that we are going to call you back. If it does get to past 6 p.m., give the on-call nurse a call. It generally, if you're not going to get a call back until later in the day, we're going to call you to let you know, hey, we know that you still haven't gotten a call, but we are just waiting for your decision. So because of this, we recommend that you're taking your gonadotropins 7 p.m. or later. So your Menopur and your Gonal-F or Follistim, we recommend you take them after 7 p.m. So then there's no stressing out if you don't get a call until after 6. Your medication inventory. Please make sure that you are aware of your medications and how many medications you have at all times. And then your side effects. There are also side effects listed in your setup book. The setup book, I believe we are going to put online if one was not mailed to you. So if you do need a setup book, there will be one placed, or we will send one with you in a link with this actual setup PowerPoint demonstration. Okay, so please remember that we are here for you along the way. If any questions do come up, your success is our success. We hope this results in a happy and healthy pregnancy and delivery for each and every one of you. So I know this is a very stressful time for everybody, and we would like to do as much as possible to take that stress away. So bear with us as we are adapting to all these changes, and we're going to try and make this process as easy as possible for you. If you have any questions about your setup class, we will have you email the nurses. You either have the Rochester nurses can be emailed at rhnurses@ivfmi.com. And then if you are a Flint patient, you will have either Mindy or Jennifer's email, and they are responding to those as well. If you do not have one of their emails and you would like to just email the Rochester nurses, we can forward it appropriately to who it needs to go to. So I hope that everyone has a clear understanding of what's going to happen throughout this process and that this demonstration helped everybody. I hope that you all are not too annoyed of hearing my voice, and I hope that everyone stays safe and ends up with a healthy pregnancy throughout this process. So thank you for your time, and please, again, let us know if you have any questions at all.